What's up everyone, it's Hunter back with another video. Today we are going to go over how I chose which residency programs to apply to, and throughout the application process what I was kind of looking for and what red flags I was watching out for in any program that I applied to or interviewed with. So it's going to be kind of broken up into two segments of the video. And for those that are new here, I am a first-year emergency medicine resident. I did match at my #1 program, and I'm going to take you through how I analyzed programs for which ones to apply to, which is going to be very applicable to all specialties. And then the second part of the video, I'll be going over kind of throughout the application process, what was I specifically paying attention to and what red flags were there that kind of jumped out about programs. So let's get into it. Apologies if the editing is subpar. Editing isn't my thing, but we're going to record my screen here, hopefully have my face down in the corner. This is the AAMC Residency Explorer tool. How do I know if I'm recording? Okay, we're gonna see if this works. On screen now is the AAMC Residency Explorer tool. Typically, I wouldn't use everything the AAMC puts out, but this was actually a really good tool for me as I was starting the process of narrowing down my list of programs. When you log in, you'll be prompted to select a specialty, and so in this case, I have selected emergency medicine. That's what I'm going into, but you can feel free to pick whatever specialty you're planning to apply to. So then when you continue, you might be tempted to go to explore programs right away, but it's best to actually go to my profile first. And this is where you will fill out the kind of parameters of the things regarding the programs that you want to apply to. So program characteristics, unfortunately, well, if you're applying this cycle, you have the option of 3 years or 3 years. But if you're applying next cycle in Match of 2027, there's a possibility that you will only have 4-year program options. Some people care about how big the program is. Typically, EM residencies are as small as 6 residents per class and as big as 30. So if you want a kind of medium size program, you could say you want programs between 8 and 15 residents per class. Oh, this is the program. So we would go between 20 and we'll say 40. I don't know. But let's say residents per class will go between 8 and 15. And you just, whatever preferences you have, I'm just throwing out numbers. I don't even care. And you go through all of these fields. So I'm going to quickly just select some things. When it comes to benefits, most programs are going to kind of have the same thing. These are listed by ACGME, and the things listed here aren't really going to change a whole lot from residency to residency as far as what the health insurance package looks like and what the benefits as far as retirement savings look like. Those are going to be program specific, and you won't be able to figure it out based on this tool, but it's definitely something to look out for when you're in the interview process and actually seeing programs. But a lot of things that can be important are like free parking, and on-call meal allowance. I have a child. It would be nice to have on-site childcare. My program does not, but that's okay. And maybe you care about having an allowance for a new computer or something. So we can select that. Practice environment. So with EM, there's kind of 3 types of program, which are going to be your academic programs, your county programs, and your community programs. You can kind of select based on that here. If you want moonlighting, you can also indicate that. And this stuff is meh, I don't really care a whole lot. So then we keep going. If you are a minority and things like the representation within the program matter to you, you can indicate that here. if you are a woman and want or a male and want a program that is very well mixed, you can kind of indicate that here. I wouldn't really mess with these a whole lot. The one thing I did look at was the medical student type, and so this will be shown in the interview stats as well as like the matriculation stats. And I was a DO, so I wanted to have some number of DO students that have come through the program in the past. So we'll just put 20%, and if you're an IMG, non-US IMG, you can put those things here and it will show up in the data. And then lastly, there's resident career plans. So if you plan on doing a fellowship or anything like that, you can put that here, but for sake of time, we're not going to do anything. So profile is all set, and now we can go to Explorer. And so based on the parameters set in your profile, the data will show up and it will only include programs that meet your criteria. And I guess it'll show all of the programs, but it'll also show over here in this green column how many of your parameters the program matches. And as you can see, there's 293 programs for emergency medicine in the country currently. And this is kind of where I stopped with this. It's a good start. So I used this to kind of set some tiers of programs that matched my criteria. And if I remember correctly, I selected about 60 programs based on what this tool put out. So then you can go and click through any programs that you want to compare, and you can also refine your exploration over here on the left. And so I believe for me, it might matter to you, depending on your specialty, which types of positions are available. There can be special tracks that are available as well. You might need a visa, so that is important. For me, location was very important. So like in this case, if we put, you can indicate which states you want. And so like, let's just say that I want to be just in the Midwest. You can just put in all of these Midwest states. I know I'm going to hurt some feelings. I'm going to stop there. There's a few more Midwest states, but I don't really care. So that will narrow down your list a lot. If you care about the location, which was pretty high on my list of priorities as far as choosing a selection, you can also do the region, which this is reflective of the regions on, it was ARIS, it's now Residency CAS, but these regions should be reflected. And so if I also wanted to say the mountain region, then the mountain region programs will also show up here. So I think that's a good start as far as refining things. And then I'm just going to say that I want to compare all of these programs. So when you select all the programs that you want to compare, and you could be selecting from that list of 293 and just pick the ones based on those characteristics and the order that they were in, which programs that you might be genuinely interested in. You can refine it like I did by location and then only compare those in those locations. But once you hit compare, it'll pop up with this screen, and you want to select the things. What we're going to do right now is generate a spreadsheet of all of the characteristics that matter to you. So you can, whatever characteristics, this is totally going to be based on your preferences and what you want to see. But program setting, I think, is important. Total number of residents in the program, number of residents in the cohort, and then applicant information. I thought these things were very important. So passing score, I guess this matters if you failed level 1 or step 1, that you want to indicate which programs require a pass. I don't know that they do a pass for like first try, but you also, I thought it was important to know the scores that were interviewed. And then you might care about their interview format. I'm going to go through and click a few more things, and then we'll jump into how I further refined my list. Okay, I just selected a few more things that I thought were relevant, and I'm actually going to show you my sheet, but once you have this, so you selected all of the things that you want included in your sheet, it will show all of the programs that you're including here, and then down here is the information. And like, sure, it's nice to have here, but it's not super easy to read through. So once we're here, you want to go to download comparison, and that is going to generate an Excel file. And I already have one, so we're going to go to the one that I made last year. So this is what it looked like. It originally had about 65 programs, and it won't be shaded with colors when you originally get it. So I really wanted to pay attention to the interview invite rate for DO students. So I just went to the column here and went to conditional formatting, and then actually for this one, I just highlighted the column, so, or the row. So went and highlight the row, whatever color you want. So that just brings your eyes to that row, and I just looked at it and kind of made some judgment calls based on how many DO students were invited. And this might change for you based on if you're a DO student, an IMG student, an MD student. But you can see along the left-hand column, these were the parameters that I had clicked those boxes on to decide which things I wanted displayed on this sheet. And then things that mattered. Entering year salary, I highlighted this after the fact because I was just curious. But percent of residents who were USDO graduates was pretty important to me. I'll be completely honest, I wasn't the most competitive applicant, so I really wanted to prioritize programs that DOs had been before, and that I wasn't trying to pave the way for a DO to get into a program. And EM is definitely a specialty that is better about kind of the mix of MDs and DOs. There's very much less stigma in the EM field, and I haven't really been affected by it at all, but that could be subject to the program that I'm at. But I did feel that it was important when selecting to know what percent of the current residents were DO graduates. And so I set up some conditional formatting. And so if you highlight a row, you can go up here to conditional formatting and then add any rules. So like you would click new rule, but I'll just show you the rules that I have set for this row. I have any cell value greater than 50 gets highlighted in green. Any cell value between 10 and 50 gets highlighted in yellow, and then anything under 10 gets highlighted as red. And you'll see this one says 0.1. I believe that the percentages, based on the way that Excel formatted this sheet when it was generated, they were written as percentage numbers. And so I went and converted them all to just normal whole numbers to then make those criteria. So you do that, and then you can scroll through the sheet and see which ones are yellow, which ones are green, and kind of make decisions based on that. And then if there were any hard cutoffs, like for the minimum step 2 CK score required for an interview, not every program has it, but some have a cutoff score. And if you don't meet that score, I mean, you just probably shouldn't apply. I'm not going to give you advice on where to apply and where not to apply, but it's very unlikely that they're going to even look at the rest of your application if you don't meet this score, so don't waste the money applying to that program. But this is basically how I did it. I'm a very analytical, systems-based person, so I decided based on 65 programs that met my initial parameters based on location and the things I was looking for in a program, and then I narrowed it down to, I believe I ended up applying to 37, and that is going to be completely individualistic based on how competitive your application is and how many programs that you should apply to. I know some people that only applied to 15, others that applied to close to 100. I felt very comfortable with my number of 37. I'm not sure how the fee structures have changed from moving from ARIS to residency CAS, but for us, anything over 30 programs costed significantly more, so I really tried to limit it to 30, and there were just a few extras that I threw in there. I think that's all I need to cover as far as selecting programs, so in the next section of the video here, we're going to cover what I was looking for and kind of what specific things I looked for during interviews and the actual applications, and then red flags to watch out for. I forgot to mention that you can also use that spreadsheet to determine which programs that you should send signals to. It's my understanding that there will be 5 signals again this year, and you should not send them to your home program or anywhere that you do an away, sub-I, or audition rotation at. And you can use the sheet to determine which programs really care about signals and those that don't, because there are some programs that don't look at the signals at all, and others that weigh them very highly when they're doing their rank list. So you can use the sheet to determine where you're going to send your signals if you don't have a very strong preference for 5 programs. When it comes to kind of like green flags and red flags, I figured I would give you my 5 of each that I felt were important when screening residency programs. We'll start with the green flags, the first of which is having a supportive culture. This is kind of hard to suss out from the website, but when you get into the interview process, you can kind of see how the residents interact with each other. You can ask them about, what they do when a resident is struggling and things like that. And it's very important as far as wellness, preventing burnout, all of those things. I felt that it was really important to have a balance of autonomy and supervision. There were some programs that I looked at that were kind of like throw you to the wolves mentality, sink or swim, basically. And then there are other programs like the one that I'm at where you can have your hand held as much as you want it, but they are very willing to let you go and do the things that you're very comfortable with. And it's important to ask yourself what you're looking for. Some people need that sink or swim mentality, and others kind of want a little bit of hand-holding if it's necessary. The next one is having a strong education structure. There are some programs that kind of just do conference every week, but there's no real rhyme or reason behind it. And then there are others that have very well developed curriculums. And the conference is a way for everybody to kind of learn the same thing at the same time, but we all know that learning is kind of an individual thing, and everybody needs different modalities for their own learning. And it can be important to ask programs about what they do to individualize learning and help residents to succeed from an education standpoint. I think wellness and scheduling is super important. Residency is known to just be a very difficult time in our lives, and there's no reason to make it worse by working insane hours that there's regulations for a reason, and programs can be very good about scheduling residents in a way that helps to prevent burnout and encourage wellness so that people can have time away from their jobs to, engage with family, their social lives, keep physically fit, and everything like that. So be sure to ask those questions, and oftentimes you can find a lot of this information on their websites. And the last kind of green flag or thing to look for is transparency within a program. There are kind of strengths and weaknesses of every program, and it shouldn't be a very vague answer when you ask kind of what weaknesses does the program have? What are you currently working on to improve the program? These are all okay questions to ask, and the answer shouldn't be vague or tiptoeing around that. My red flags, there's 5 of them, are somewhat difficult to figure out if you don't rotate at the program, but oftentimes you can get a feel for them through the interview process. So the very first one is residents seeming miserable. This is kind of going to be indicative of their general well-being, and you'll only really experience it either during a resident social or while doing a rotation there. And you'll just kind of see if the residents hang out outside of work, if they have time outside of work, and if they truly enjoy what they're doing and, being in this chapter of their lives. I am ecstatic to be where I'm at. I'm only 3 months into intern year. I might still be overly ambitious, but I am absolutely loving my job and what I'm doing. And there will be programs where you can't say the same about their residents. My second red flag is kind of just the opposite of my fifth green flag, which is lack of transparency. If anybody is tiptoeing around questions in your interviews or not being clear about different disciplinary actions, things at the program, that's a big red flag and turn off. You want the administration of your program to be very transparent and keep everyone in the know on what is trying to be improved and developed in the program. The next one is going to be kind of hard to get, but is pretty obvious if it's there, and that's a toxic culture. One aspect of a toxic culture are, attendings that yell at residents and consultants that aren't helpful to the interns at all. And you're going to get a few of those at every program, but you might not hear about it when you're doing your interviews and things. One aspect of a toxic culture from my perspective is if a program doesn't do very well when it comes to helping a struggling resident. There can always be times where we start to fall behind on procedural skills or, knowledge base. There can be a vast number of things that you fall behind on. And it's really important that the residency program has a structure in place to help those residents so that they don't end up falling further behind. Another red flag is a poor work-life balance. I haven't experienced it at all. As you can tell, I'm very happy. But there are some programs that don't really protect your vacation time very well, or they don't have a great call system for if somebody gets sick and can't come in to work their shift. So it's really important to kind of delve into the weeds of how they do their scheduling and how they protect their time to make sure that there is a good work-life balance that residents are able to take advantage of. And my final red flag for this video is being under-resourced. This can mean a lot of different things, but in my mind, I was kind of thinking of not having enough patient volume to, demand good learning, but then also having too many patients and not enough residents that you end up getting stretched too thin and also can't do your job very well. One thing that was important to me was the EMR system that the residency program uses. I don't think using a clunky EMR system is going to make residency any easier or better. So I actually prioritized the EMR systems when I was applying to different programs and deciding who to interview with. And lastly, there can be a lot of turnover when it comes to nursing staff and ancillary staff like techs and custodial staff. And this can be very important. So it's really good to make sure that kind of all of these boxes are checked when you're considering any program. Every program has its flaws, but it's important to seek out one that has a supportive culture, strong training, and graduates that go on to succeed, whether that's in fellowship or in their community jobs. Trust your gut. If something feels off during the interview process or while you're applying, if you read something on the website that just doesn't sit right, you're probably right, and it's best to stay away from that program. I feel like that's been enough rambling for this one, so we will catch you in the next one.